Hello everybody, my name's Kasim, a junior doctor working in the West Midlands and part of the ACE FY1 team. So we're a team that's helped to put on a course in the past few years, easing that transition between being a final year medical student and a FY1 doctor. So traditionally this was a one-day course in various cities from Birmingham to London. We had over 100 attendees collectively, and we focused on three distinct sections: being an effective doctor, so looking at the board round, money matters and portfolio; being a safe doctor, so using interactive activities such as triaging bleeps and a simulation exercise looking at human and intrinsic factors. And then the last section was more of a discussion based on self-care tips and our role within our communities as well. So we'd had everything planned out for for 2020, and then COVID came along. So as you can imagine, it kind of threw our plans out the water, but it gave us an opportunity. So instead, we put on a webinar attended by 600 participants, and we put it on the space of 1 to 2 weeks with our brilliant team of speakers and organisers. And we focused on the first part of it, being an effective doctor, on the ward round and how to document properly. We focused on the second part, of this being a safe doctor, on using existing mechanisms and structures that medical students are aware of to support their new practice. And then we added a new section, section 3, about COVID. So how the top tips and tricks and hints that we'd picked up from working in hospitals on the front line, and how we'd advise them, for instance, how to where to get scrubs from and how to make sure they're not bringing the infection home with them. And then the last section was really important because it focused on self-help and mental health and their role within the community. And we wanted it to be a bit of a boost for them, that saying, despite these unprecedented times and despite all the negativity, actually what they were doing was valuable work, and that they would be supported and where to seek support from. So it was incredibly well attended by 600 participants in the short space of 2 weeks, and we received fantastic feedback about participants saying how it changed their future practice and how it made them better doctors. So we're incredibly grateful for them for attending and the opportunity to showcase this work.